India is a country on the crossroads. On the one hand, it's poised for great growth, and on the other, it has to grapple with the most basic of problems. And nowhere are the first world aspirations and the third world problems more apparent than in the healthcare space, where we have the best facilities coexisting with the worst. So what needs to be done to get the best in healthcare to all? That's the question that one of India's best-known entrepreneurs asks in this special series.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My first guest is a very special man, Dr. Montek Singh Ahluwalia, who has a very special responsibility of planning India's future. Over the next 30 minutes, I will be speaking with Dr. Ahluwalia to see what he has in mind in making sure that healthcare is a part of our development agenda. Montek, thanks so much for coming on the show.
Well, pleasure.
You know, I want to basically brainstorm with you on how do we go about really seriously building a healthcare system for this country, because we have nothing at the moment.
Well, I wouldn't say that we have nothing, but the total expenditure on health in India as a percentage of GDP is roughly comparable to that in other developing countries. The difference is that government expenditure is very, very small. It's now a little over 1%, and basically a lot of the other costs are borne by individuals, which is really people paying out of their own pockets.
80% of that is paid by people.
Yes, and I think that is wrong. That's why at least the target that we've set for ourselves is that we ought to take public expenditure on health somewhere between 2 and 3% of GDP. I think in addition to that, you have to find out what kind of system do you want. I mean, one approach, for example, is that you simply expand the public sector health delivery system and expect that it will deliver all the health that people need. And if people don't like that, they can go to the private sector and then they can pay whatever the private sector wants.
Well, you know, right now the feeling is that that's not the ideal model, because if you look at what's happening today, 60% of hospitals are in the private sector.
Yeah.
50% of hospital beds are in the private sector. And everything that's in the public sector is considered to be suboptimal, because you know they are functioning with 30% of the human resource needs. They are also functioning in terms of its critical inputs or its in essential goods that are required to deliver good healthcare at 30% levels.
Well, let me say a lot of what you're saying is right, but I would put it this way. I don't think it's an issue of public sector or private sector. Both have to perform better and improve. The real issue is if government is going to spend more money, it can either spend the money on public sector facilities which provide services free, or it can subsidize a general insurance system which would be available to most people. And with that insurance, the people concerned can either go to the public sector or to the private sector on a reimbursement basis. Now, you know, in the Rashtriya Swasth Bima Yojana, which is really meant for the BPL population, the government is spending the money, but the government is not necessarily delivering all the services. So actually, we do need a system which, first of all, ensures that everybody, including the poor especially, are assured access to a basic level of health with either no cost to themselves or very, very minimal cost. On top of that, we need to have a good quality private healthcare. We also need to have a good quality public healthcare. Now, there are a lot of management and accountability issues, and I think there's a lot of regulation also. You need to think hard about what is a sensible health system. You know, the United States, for example, is widely regarded as having the best medical care and one of the worst health systems. I mean, they spend much more money to receive poorer health outcomes than the Scandinavians do.
Yeah.
So we can't just go and emulate the Scandinavians. So we need to do something which is right for India. And you know, we're going to work on this in the 12th plan, which is just about to start. Actually, we've set up a high-level committee under Dr. Srinath Reddy. And we're asking them that for the 12th plan, you know what we are doing, and we're obviously going to have to do more. But for the 12th plan, how do you think we should operate to make our efforts more effective? And that's a very important area. We certainly, by the way, have to spend more money.
The Planning Commission's Deputy Chairman agrees that higher budgets need to be allocated as the first step towards building a national healthcare system. But as he gets set to prepare India's next 5-year plan, what should he keep in mind while budgeting for it? Ensuring access to the best in healthcare to all at an affordable price is not a challenge that just India faces. In the US too, this has been a major issue. And despite the government there announcing the biggest healthcare package ever, the famous Obama healthcare plan, a lot needs to be done. So what are the lessons learned for India?
You know, we are trying to now build a health system from scratch, you know. And if you look at somebody like the US, where you have the best healthcare but at the worst possible cost structure and the most inefficient kind of health system that you can even come across. Now in the US, they have clearly recognized that one of the biggest problems that the US faces is that they do not have a very rigid and robust infrastructure to support the healthcare system. So e-health and IT, health IT is becoming a big issue for them. And they have recently actually outlaid $200 billion entirely for health IT. I think that's a very fundamental building block for us as well. You know?
Oh, absolutely.
And you know, that's something which we should think about when we are trying to, you know, budget out the healthcare spends in the next plan.
You know, a lot of this, I completely agree with that, by the way. I mean, I think IT, the UID, and all these things make it possible for us to radically revolutionize systems of delivery. But there are a lot of resistances to making those changes. I mean, let's take a simple case. Let's take this central government health service. Okay, that's a centralized, effectively it's an insurance system where a central government employee is covered until he dies. Now, if you were to, I mean, technically, if you were to convert that to an IT-based system, any central government person going to a doctor in the central government health service should have a card which, when swiped, tells the doctor exactly what the person's medical history is. Now, it may be difficult to reconstruct it now, but if you start now, within 10 years, you'll have it. You know, doctors very often are not very keen to have a system where what they prescribe could get double-checked against what the person's medical history is.
But that's the whole point of
regulating. That's the whole point. So,
right?
therefore, it's not the IT, it's not the money. You've got to get a radical change in medical practice, willingness to accept certain things, and a demand on that of that by the individual. So, you know, it's sort of a number of things will come up. I don't want to be negative. What I'm saying is we have a huge opportunity to leapfrog. We have a huge job to do. It's not a question of just letting the private sector do it, nor is it a question of just expanding the public sector system. And you've got to bring the financing into it. In the sense that the government has to spend money both on facilities and on insurance premia. Individuals have to spend money. The corporate sector and the organized sector should be encouraged to make joining a group health scheme compulsory. I mean, it should be part of the terms and conditions of service, which it isn't in most cases. I tell you, I mean, in the 11th plan, we emphasize the importance of health and education. And I think we've made a good start. We put it on the agenda. I don't think we've provided as much resources as are really needed, but you know, the system didn't have the capacity to absorb them. When you start something, it takes a long time. But in the 12th plan, you know, which begins in the year 2012, the system is now geared up. It's crying out for resources. So this is going to be one of the big challenges. Are we in a position to shift resources from the sorts of things we used to do and put them in health and education? I think we should, no question about it.
But that's why.
Second point, it's not just the central government. Most of the money on health and education has to be from the state governments because it consists of salaries. So it's one thing for the central government to be aware of this, but we have to make this a priority at the state government level also.
You know, there are many state governments today who have introduced this micro insurance scheme, more as a kind of a vote-winning kind of a scheme, you know, if I may say so, you know, which are obviously being very welcomed by the people at large. But again, if you actually look at these schemes, they are not sustainable in the long term.
Well, I think that's very true. Many of the schemes have not been actuarially worked out.
Exactly.
In a lot of these things, what happens is you keep expanding the services, but you haven't worked out what it's going to cost. In fact, in the case even of the Rashtriya Swasthya Bima Yojana, we've issued a number of cards. But you know, the awareness of the guys who got the cards that there's a service they can now demand, this is going to take a little bit of time to build up. So the actual, whether the insurance system is viable will only be known when people start fully demanding the services that they're entitled to. And some state governments have schemes that are much more generous than the Rashtriya Swasthya Bima Yojana, and they are running into difficulty in the sense that the bills are mounting. So, you know, that happens in any insurance-based system, that if you don't look out for ensuring that the scheme itself is viable, you run into difficulties. But fortunately, we've only just started. So at the start of the 12th plan, we are in a position to sit back and say, look, these are the different experiments. This is what is worth supporting, and this is what we should do.
Montek Singh Ahluwalia, the Deputy Chairman of India's Planning Commission, is in the middle of formulating the next 5-year plan for India. And even as Dr. Ahluwalia is targeting a 10% growth rate for the economy, he agrees that ensuring a higher spend on healthcare will be crucial to ensure that this growth is sustainable.
I'm really pleased to hear that at least in the 12th, 5-year plan, we are seriously looking at least starting to build a national health system where the government certainly wants to raise its spend from say 1% to 2 or 3%, and where the private sector can top that up and make it like close to even 10%. Now that would then create a very robust and a very sustainable model, because even today 80% of an incremental spend in healthcare is coming from the private sector, you know. And what is also really good for us is the fact that we have a very robust pharmaceutical industry, which is also allowing us to have affordable drugs to support this system.
No, I mean there are lots of strengths, but really in the 12th plan, what we've got to do is at the very minimum double as a percentage of GDP the spending that we do in the health system. You know, it's not true that we don't have resources. I mean, for example, 1% of GDP is effectively what we actually spend on subsidizing kerosene and LPG. Now, a lot of people feel that subsidizing kerosene and LPG is important for the poor. But imagine to yourself whether it would not be better not to subsidize that to that extent, because we know there's huge leakage, and put the money that is saved into health facilities for the poor. So, I mean, if we wanted to redirect our resources, the resources are there. But we cannot keep doing these things and find another 1% of GDP for health and another 2% of GDP for education. I mean, the 12th plan will have to address these issues.
Absolutely. And, Montek, finally, I would say that, getting the Public Health Foundation of India involved in helping us to sort of develop a good and innovative national healthcare system is also going to be a very, very good way of doing it.
Yep, I agree.
And I think all the stakeholders in the healthcare sector are very keen to see that we develop such a healthcare system, because I think everyone can benefit. It is already forecast that the healthcare sector is likely to attain a size of $300 billion by 2025. This is a huge opportunity for everyone. So I think it is a very exciting time for us, but we must ensure that we do build an inclusive healthcare model which allows everyone to benefit.
The advantage, we have some advantages. I mean, one is there's a lot of low-hanging fruit. Better maternity care, early diagnosis of complicated cases of pregnancy, a little bit better malnutrition treatment and prevention. These things alone would make a huge difference to some of the key indicators like the maternal mortality rate, the infant mortality rate, etc. I think that should be very easy to do even within the existing system. And some of the information I get is that by the time even this plan ends, when you get the latest data, you will see that the infant mortality rate and the maternal mortality rate is reducing faster than it was doing earlier because of the National Rural Health Mission and all these ASHAs and this counseling that's taking place and so on. I think immunization and vaccination, I mean, that is a low-hanging fruit. It is completely unjustifiable that only half the Indian children are getting a full dose of immunization. Very simple expansion of both public and private health services, not very high cost, but just determined with accountability, could raise this to 100%, which it should be. That alone will lead to. Then we get into the more complicated issues of treating the kind of diseases that are more chronic, diseases related to age, diseases related to lifestyle, and we have to tackle those too. But like in the next 5 years, in my view, if you tackle the low-hanging fruit, you can get a huge outcome, and we should be concentrating on that.
Yeah, unfortunately, we are a country with, the kind of challenge of the developed world and the developing world. Basically we've got, we can talk about a young population, but we also have a significant aging population. So the numbers are staggering, So it's a huge challenge, but I have no doubt that, through a lot of brainstorming, a lot of innovative ideas can come up, and we can actually create a very, very interesting healthcare model, which, the world will be very interested to emulate.
Well, I mean, the world will be watching us very closely, after India and China. Because China also, by the way, in the early stages of their reform, they ended up slightly dismantling the public health system. But in the last few years, they've brought out new health policies that seek to correct that mistake. So people will be watching India and people will be watching China. And I think we should be aware of what the Chinese are doing and try to learn from that.
Thanks, Montek. That was most interesting.
Thank you, Kiran.